Welcome to the Spine and Rehab Specialists podcast series, episode number 3. I hope everyone is enjoying our podcast series so far. We've been tackling a couple of interesting subjects in the field of physical therapy. First with Dr. Joseph Hernandez on our post-COVID-19 rehab program, which is really starting to take off. And then the last episode was with Dr. Anthony Durant on musculoskeletal ultrasound. So I think we've had some really interesting subjects, so hopefully everybody's enjoying them. Now, this week, we're going to be talking on the subject of obesity. And with me today, I have Dr. Andrea Gotje. Andrea, welcome. Glad to have you with me.
Hi, everyone. I'm happy to be here.
So, Andrea has been with Spine and Rehab Specialists actually exactly 2 years today. So, congratulations.
Thank you.
And she was even with us, before that as a student. So, we're very happy that she chose to work with us. Andrea was born in El Paso, but grew up across the border in Ciudad Juarez. So she definitely understands that whole binational cultural aspect of El Paso. And of course, she's very fluent in both English and Spanish. We are going to do the podcast in English, though, today. So, and on top of that, she teaches in the Doctor of Physical Therapy program at UTEP. So we're talking about obesity today. It's definitely not an easy subject to talk about. I think it can get a little touchy with people, but I think at the same time, it's well worth having this discussion. So, because when you look at the numbers, they're truly staggering. According to the Centers of Disease Control, 74% of people in the United States are overweight. That's 3/4 of the whole population of the U.S. According to the same CDC, from 1999 to 2018, the rate of obesity had increased from 30.5% to 42.4%, with 9.2% considered severely obese. So not only is it a big problem, no pun intended, in this country, but it also seems to be getting worse and worse. So Andrea, what do we know about the causes behind this obesity epidemic?
So let's just say obesity has just been an issue that has been here for several years, and it's something that has just gotten completely out of control. Now, people tend to think that people always choose to be obese, or it's something that it's only related to behavior, but that's not always the case. So there's different causes and individual factors that can affect why or how a patient I'm stuck to with the word patient, how people become obese. So it can be all from the behavior, including physical activity, what they eat, what they don't eat, medications that they take. But it can also be due to genetics. It can be due for other environmental factors like their availability of actually healthy food, or the education they have on the subject, or how they grew up, or how they see themselves and what they're used to eat based on their family environment.
Yeah, so it's not necessarily as easy as saying, well, somebody's overweight because they eat too much. It really isn't that simple, is it?
No, it's not like that. Not like that at all. And the thing is that with obesity being such a big issue, we're getting a little bit more information about what causes it and what not. But we're also trying to tackle it and trying to come up with plans to try to regress it or make it a little bit better. Yeah. And the reason behind it, it's because it's not only about being obese, and it's not only about the health effects it's going to have on you. It's also about other type of health outcomes, like mental health is greatly affected, quality of life is greatly affected, and obesity is also associated with other very important medical conditions that can lead to death, including diabetes, heart disease, stroke, and some types of cancer even.
Yeah. I mean, I think we all know that being obese is not a good thing, but there is, so much to it, right? There's so many effects of it, and we know it contributes to heart disease and strokes, and I think that's a pretty well-known fact, but I think it's good to really try to understand all the other effects that it has on all these other diseases, and even on the mental part and everything. So I think it's good to talk about this subject. Now, there's another area, and people may not realize that obesity contribute to things like soft tissue damage, osteoarthritis, and things like that. So can you talk a little bit more about that?
Sure. So I think we all have heard the word osteoarthritis very often. I think every day at the clinic we hear patients coming to us and blaming everything on osteoarthritis, like, oh, it hurts, it's the arthritis and stuff like that. But It's a really bad issue, and it has gotten also worse over the years. So what it is, it's just a joint disorder, and right now it has estimated to affect about 40% of the adults over the age of 60, and it's one of the leading causes of pain and disability. As I mentioned to you, every day at the clinic, at least I see 5 patients that would come to see me because of issues related to arthritis or osteoarthritis specifically. And just as the obesity, it's not only the physical effects it has, it's related to loss of productivity at work or in the house environment, work environment. And it also accounts for about 97% of the total knee replacements, and about 83% of the total hip replacements are performed because of osteoarthritis changes.
Yeah, and I guess that makes sense, right? Because when you're walking, every extra pound, is going to give me an extra pound of weight on my, hip, knee, and ankle, but especially the knees, I think they take it the worst, right? So, it makes sense.
Actually, it's more than that. For every pound that your body carries, or your body weight, it places about 4 to 6 pounds of pressure on each of your knee joints. So it's not only 1 pound. It can go up to 4 to 6 times that amount of weight in terms of pressure to the knee joint.
Okay, let's think about that for a minute. So you're telling me that if someone is 50 pounds overweight, they're adding 200 to 300 pounds of extra pressure on the knee joint? That's a lot. So I don't want to even do the math on somebody who's maybe 200 pounds overweight. And those people are definitely out there, right? At the moment somebody weighs 350 or 400 pounds, that means they're 200 pounds or more overweight. So that's just an incredible amount of extra pressure.
Exactly. So you can see now why individuals with obesity or that are overweight are up to 20 times more likely to need a knee replacement than those who are not overweight. So it's very difficult on the joints, and people wonder like, oh, why does my knee hurt so much? Well, you're putting 4 times the amount of your weight in pressure in your knee joint. So that's one of the reasons.
And that's with every single step you take. So that is an incredible amount of extra wear and tear on the joints. So we used to think that knee osteoarthritis is mostly just a wear and tear condition, but that's actually not even true, right? It's worse than that.
Yeah, and there's, just as with any other health condition, there's different factors that can affect it. But something very interesting is that fat tissue can affect how your joints are getting degenerated. So an article has found that the metabolites, or the little components of fat tissue, can promote joint degradation. So if you are overweight, it's not only the pressure that you're putting on your knees, which obviously greatly affects it, it's also those little metabolites that are in the fat that can also be contributing to the degradation of the joint.
So it's not just a wear and tear, but it's also these chemicals, that are part of fat that cause it. So, well, I guess we need to do some investments in companies that make total knee parts, right?
Oh, definitely. I think it would be a good idea, because the number of total knee replacements, as we said, has greatly increased, and it has doubled in patients with obesity. Now, the bad thing about that is that it's not like you do a knee replacement or a hip replacement and it's over, the pain's gone. No, actually, the complications and the outcomes from the surgeries are greatly impacted in patients that are obese, and you might have different issues afterwards, including higher rates of infection, failure of the prosthesis, loosening of the implant. Like, there's a bunch of things that you are more likely to experience when compared to someone that has normal weight.
So that's really a bigger problem than we thought it was. So we know that obesity contributes to knee arthritis. And, that will cause us to have knee replacement surgeries, for a good amount of people. But then at the same time, that obesity also causes other health conditions that give us worse outcomes on those surgeries.
Exactly. So as we talked before, obesity is linked to other conditions like diabetes, heart disease, pancreatitis, some cancers, some psychiatric disorders. So all of these are going to contribute on the way that you recover from an injury or from a surgery, better said. So the pre and post complications are greater. Wound healing might be delayed. You might have infections. You might experience blood clots that can even cause death. Or you might end up having to have a second surgery to replace the replacement because it didn't work. And this is also caused because of the obesity.
Yeah. And unfortunately, we see that in the clinic where we have the people that have the total knee replacement that thought it was going to be the simple quick fix and all my pain's going to be gone, and it isn't. And I'm not knocking on total knee replacement surgeries. A lot of them go really, really well. But I think at the same time, we should not take those surgeries that lightly because there is more to it than just simply replacing it. And as physical therapists, we can definitely help with the post-operative rehab on total knees, and we're doing that on a daily basis. We've done that for many years, and like I said, most of them really do well. But maybe somebody who's a candidate for total knee replacement, but also is dealing with obesity, should think a little bit more about that before they jump into the surgery, because it may not be as easy as it sounds, right?
Exactly, correct. And I think it's something that has been changing in the last couple of years. I think more often now we see patients for pre-rehab to get them ready for the surgery itself, so they have better outcomes. I think it's something that's slightly and slowly changing. I do see a little bit more patients that come for that same reason, but it's not as much as we should. And remember, obesity as a disease needs to have different things addressing it, but the first thing is always going to be patient education, physical exercise, and weight loss. So that's the first thing that we should try to do even before we jump into a surgery.
Yep. And I can tell you, the patients I've seen in the clinic that do the surgery or the therapy before surgery, they do so much better after surgery. And of course, some people, they do the therapy and they don't need the surgery anymore. It's even a better outcome. So, going back to the obesity part, so we want people to lose weight, and we know that one of the pillars of weight loss simply is doing exercise, right? I mean, it's still what we know is exercise more, expand more calories, eat healthier, less, consume less calories, and we know there's a lot more to it, but that is still part of it. And it's great to tell a patient you need exercise. And probably one of the easiest exercises to do is walking. But how do you tell somebody who has that painful knee, go walk? Well, they're not going to get very far, literally, not very far in walking and not very far in their weight loss. So are there other options out there for patients rather than just go for a walk?
Of course, and as you were saying, it's easy to say. It's easier to say than do that. Okay, I need you to exercise. Well, how do you want me to exercise if every time I move, my knee hurts or my hip hurts or my back hurts? So that's when physical therapy comes into place. One, because we are educated professionals that can try to help you address your pain, manage your pain so mobility is better, because it's a really sad cycle. It's a vicious cycle. I stop moving. Every time I try to move again, I hurt more, so I move even less the following days. So it's really a vicious cycle that we're trying to break. So there's different things that we can try, but one of the interventions that it has shown to be most effective for patients that have not only knee pain but also experience obesity or suffer obesity is trying aquatics.
Good. Yeah. And then, so we've had aquatics for many years, going back to our clinic on Zaragoza. And for those of you who kind of know us a little bit, we were on the Zaragoza Road for many years, and then we moved to Physicians Drive last year with a much bigger, much nicer pool, because we really believe in aquatics as a type of exercise that really helps people, especially with the painful knees, hips and ankles too, and back pain too, but definitely on knees, and get them in the water, get them exercising. So have you encountered any evidence on that, or is this just something that we feel as therapists that this is helpful?
No, definitely. There is a lot of studies being done on aquatics. And I was actually able to find some studies done specifically for patients with osteoarthritis and obesity, and trying to see what type of intervention would work best for them. And so I saw this specific study that they were trying to compare land therapy against aquatic therapy in patients with osteoarthritis that were obese. And what they found is that not only the aquatic had a better outcome in terms of pain management and quality of life and overall feeling better, but also the aquatic group decreased more in the percentage of body fat than the other group. So it's not only that you're exercising with more ease, less pain, you feel more comfortable, but you also helping with that weight loss or that decrease on body fat.
So you're really, doing two things at the same time. And I think that's really awesome. And I think it's good for people to know that that is one way to really work on both, your knee pain as well as the obesity. So if somebody is interested in starting to pursue this road of working under obesity, and they struggle with walking, and they decide that they want to try the aquatic environment, even that is easier said than done, right? Because not everybody has a pool in their backyard, and it's wintertime, so even if you have a pool in your backyard, it's probably pretty cold. So, and community pools have been closed mostly because of the pandemic. So what does somebody do that with this advice of doing aquatics for knee pain and obesity when they can't really go anywhere?
Well, you can come and find us because we do have a pool. And one of the cool things that we have, as you were saying, we just changed locations. We got a bigger pool, a nicer pool. We have an underwater treadmill. So we have a really nice piece of equipment that can be used. And we know we're not the only physical therapy clinic that has a pool, but it's not because I want to brag, but ours is really, really nice. So we have a really nice piece of equipment. Now you need to think of what's the benefit of doing aquatics. Like, why is it facilitating movement, or why is it decreasing pain? One of the main reasons is because when you're underwater, you're not carrying all of your weight. So remember, we talk about those 4 to 6 pounds of pressure in the knee for every pound of body weight. So when you go into the water, you are decreasing that. So, and depending on how deep in the water you go, we might be able to decrease the amount of body weight that you're carrying to 20%. So that's why it's such a good intervention, because we can literally try to improve that pain that you're having because of all the overload your knees are undergoing, or your back, or your ankles, on your hips. So definitely come and find us. We have a pool that would allow us to have 2 people in it for treatment and still carry all the recommendations that CDC has done in regards to COVID. We try to be careful. Everyone's wearing a mask. And you're always going to have a physical therapist there with you during the treatment with you, so they can modify as appropriate. And if needed, the physical therapist will even get in the pool with you to assist you with balance or with other issues that you might have. Or if you're just too afraid to be in the pool by yourself, we can help you with that too.
Yeah, and even access into the pool is pretty easy. We have, of course, we have stairs to get into it, but we also have a chairlift that goes into it. I think one of the nice things, too, that we have is those underwater cameras, so we can even, us look, or you yourself look at how you're walking, how you're putting your foot down, are you extending your knee fully and everything. And I think that's very helpful, too.
Exactly. And as I said, we have the underwater treadmill, so that allows us to patients that have the intention to go back to running, even to get started there. We have had patients that have not run in years, and we put them in the water, and after they have improved and their pain's better and their strength is better, we start them on a running program in the pool. And it's something that's very unique, and they usually love it, and they appreciate having the opportunity to go back to an activity that they couldn't do before, and hopefully little by little get him out of the pool and transition them into a land program so they can continue meeting those goals. Now, if the pool is something that you just don't want to do because you're too afraid of water, or you have another condition that might prevent you from getting in the pool, like having experiencing seizures or things like that, we have another option. Do you want to tell them a little bit about that?
Yeah, so obviously, pool isn't for everybody, and some people just don't want to get in the pool. Right. But there's a lot of other things that we can do. So I think one of the nice pieces of equipment that we have is the Ultra G anti-gravity treadmill. And yes, it looks like it's space age, and it kind of is, because it was actually developed for NASA to be able to reduce the effects of gravity that astronauts have on the moon. So we can reduce the weight bearing. In essentially you're in a bubble. You wear these special shorts, and the bubble gets blown up. It's a kind of a balloon that you're in, and then you're walking literally partially on air. So we can, in that way, also reduce the weight bearing that people have. So, and we can, have it go from, 20% of weight bearing to 99% of weight bearing. And then, the next step would be 100%. So then you're back on full weight bearing. But I think it's a really good piece of equipment for people to gradually go back to normal weight bearing. And we can start them off, taking their pain away when they're walking. So maybe they're walking, they have pain when they're putting 100% of their weight on it, but they may not have pain at 60%, and then little by little go up. We can even just do simple exercises in the treadmill and do some squats and do things like that. So I think it's a great piece of equipment. What do you think?
Yeah, I agree. I love the Ultra G, and it's another piece of equipment that we use daily. And I also like getting my patients from the water out to land and having that Ultra G piece of equipment in the middle to facilitate, because for some patients, they do really good in the water. They're doing great. They're feeling great. But as soon as you transition them out to land, their pain comes back and they're not as motivated to come back for treatment. But if we add the Ultra G in the middle as a stepping stone before transitioning back to fully land, I think it's great. And as you were saying, like having the ability to control how much weight you're actually carrying, it's awesome, because in the pool, I mean, we have a decent pool, and I think the depth of the pool is like 4'6" or something like that.
Yeah.
So if you have a very tall patient, I mean, I might be only able to reduce the amount of weight they're carrying to 50%, and that's a lot. Not even 50, maybe like 70%. Or in the country, you have a very short patient, so I'm trying to progress them, but since they're so short and the water is basically all the way up to their neck, it's kind of difficult to progress them in that way bearing transition. So the Ultra G doesn't have that issue. It allows us to control percentage, and it doesn't have anything to do with how tall or how short you are. I can control it even if you weighed 300 pounds, and I can still control it even if you weighed 120 pounds. So it's a really nice piece of equipment. So if you are suffering from knee pain, hip pain, back pain, and you are also obese, and you're kind of scared to come to physical therapy because you think it's going to hurt too much, we have options. We can get you started in the pool, transition you slowly to land using the Ultra G, and hopefully we will be able to have you fully transition to land so you can continue to exercise on your own without having to have a pool in your backyard.
Yeah, and I think that is just really reassuring for people to know that there are ways to get back to normal life. Yeah, and yes, the pool is great, but ultimately we all live on land, right? I mean, we're not living in water, although some of our patients would probably want to live in water. But so for somebody who is, obese, overweight, maybe has, knee problems and everything, there is something you can do to help improve not only your knee pain, but start working on that obesity, start making progress towards, solving some of the heart disease issues, blood pressure issues, all those things that come with that picture of obesity and being overweight. So I think it's good for people to know that there is hope. And so when they're being told you need to exercise, to not say, well, how am I going to exercise? Then say, hey, can I go to therapy? I know they're going to help me.
Correct. So please come find us. To our physician location is the one where we have the pool. Our other clinic, unfortunately, we don't have a pool, but we do have an Ultra G. So even if we have you just for a couple weeks in the pool and then you're ready to transition, we can have you out and try the Ultra G. We'll help you. So just come and find us.
Yep. We have so many ways that we can help you, and that's what we do. We love helping people. All right, well, this is the end of episode number 3 of the Spine and Rehab Specialist podcast series. Andrea, thank you so much for being part of this episode. So we learned more about the effects of obesity and being overweight, but also, there are things that we can do to help you. So come see us, and we'll see you next time.
See you next time.